Hello everyone, my name is Chris Nasso and I'll be talking about using SQL for predictive modeling in healthcare. This presentation was created for the Healthcare Databases course at George Mason University and is going to show a high-level simplistic overview of how you can create predictive models using SQL software. So first and foremost, it's important to understand what we mean when we say predictive modeling. In a nutshell, predictive modeling is when individuals, like ourselves, take existing information and data and utilize statistical analyses to predict the likelihood of a given event occurring. Within electronic health records, this usually takes the form of a look back. For instance, we could select all patients who suffered a stroke in the hospital and do a look back to see what characteristics in their profiles may be predictive, what we would otherwise call a predictor, and are associated with a higher likelihood of the stroke outcome occurring. If these predictors can be identified, then we can develop interventions to mitigate and prevent the stroke outcome from occurring. In order to identify these predictors, we would need to develop a likelihood ratio, which takes two sets of conditional probabilities and divides them against one another to determine the likelihood of a predictor on a given dependent variable or outcome. By doing this, we can determine the probability or odds of the dependent variable occurring based on a given predictor. In order to simplify the understanding of this concept, we're going to walk through a specific example utilizing asthma as a predictor with the dependent variable or outcome we are trying to measure as mortality. Essentially, we want to know the association between individuals who have a diagnosis of asthma and whether or not that diagnosis is associated with higher mortality. The specific code we are using for measurement is unspecified asthma with the ICD-9 code 493.90. Here's what this looks like when plugged into the likelihood ratio. In this example, our likelihood ratio is the number of those who have died with a diagnosis of asthma divided by the total number of those with asthma. This is the top row of the likelihood ratio. The bottom row of the likelihood ratio is the number of those who have died without a diagnosis of asthma divided by the total number of those without a diagnosis of asthma. These are divided against one another. If the number of those who have died with a diagnosis of asthma compared to the total number of those with asthma is higher than the number of those who have died without a diagnosis of asthma compared to the total number of those without a diagnosis of asthma, then we are likely to see a positive association with the diagnosis of asthma being associated with mortality. This is what the top row of the likelihood ratio looks like when calculated in SQL. Essentially, what we're looking to do is to create columns for those who have died with asthma as a diagnosis and the total number of those with asthma. This will be divided against one another, and then it'll be divided by the bottom row of the likelihood ratio. What we have here is essentially a formula that says if ICD-9 equals I493.90, which is the code for asthma, and age of death is not null, meaning that the person has in fact died, return a value of 1. If not, return 0 for the dead with asthma column. The second one says if ICD-9 equals I493.90, which is the code for asthma, then return a 1, if not 0, for the total with asthma. As you can see on the bottom, there's 3,905 individuals who have died with asthma. The total number of those who have asthma is 33,920. This is the bottom portion, or the bottom row of the likelihood ratio. Similar to the top row of the likelihood ratio, we're looking for two column values, those who have died without asthma and the total number of those without asthma. These will be divided against one another and will be divided against the top row of the likelihood ratio. When we look at the formula, we can see that we have the if function again, which says that if ICD-9 is not equal to I493.90, which is the code for asthma, and age of death is not null, as in the individuals have died, return a value of 1 for those who have died without asthma. If ICD-9 is not equal to the asthma code and age at death is null, meaning that they are still alive, return the value of 1. When we look at the bottom, we see the two-column results. There are 4,278,553 individuals who have died without asthma. The total number of those without asthma is 13,130,969. So now that we have our two values for the top row of the likelihood ratio and our two values of the bottom row of the likelihood ratio, we can figure out what each of the values are for each of those rows. What you don't see here is that we've actually created the double hashtag LR table using the into function, which has included the dead with asthma, total with asthma, dead without asthma, and total without asthma values. In order to get the top row, we've taken the dead with asthma, cast it as a float, and divided by total with asthma. And that gives us our top row value, which you can see below. For the bottom row, we've taken dead without asthma, cast it as a float, divided by total without asthma, and that gives us our bottom row figure. So here we have our final likelihood ratio value. We're going to get this by utilizing the previous table and the top row and bottom row values into the double hashtag final LR table. The way we do this is we're going to cast the top row as a float and divide by the bottom row and get the result of 0.353 for our likelihood ratio. So what do the results tell us? Well, a likelihood ratio of 0.35 tells us that a diagnosis of asthma is not a strong predictor of mortality compared to those without a diagnosis of asthma. In order for a positive association between a predictor and outcome, in this case mortality, the likelihood ratio would have to be greater than 1. While this is an important observation, it does not take into account some potential confounding factors, such as the fact that this table included those with diagnoses, and we compared those with an asthma diagnosis versus those without an asthma diagnosis, which meant that they had some other diagnosis. It'd be interesting to see if we could do this study with those who had not presented or had information entered into an electronic health record and did not have other associated diagnoses. For the time being, these are our results. We'll have to look forward to future studies and appreciate your time and attention.